Good morning, everyone. Thank you for being here today. To those in the room and the hundreds joining virtually across America and across the globe, it's my great privilege to welcome you to the 50th Annual AAKP National Patient Meeting. We're pleased to bring this year's event, where we're celebrating its golden anniversary, to the great state of Texas in the fine city of Fort Worth. My name is Edward Hickey. I'm honored to serve as president of AAKP, and as a United States Marine Corps veteran, I also serve as the chair of AAKP's Veterans Health Initiative. I became involved in AAKP nearly 10 years ago, and throughout my time, I value how AAKP stands as an independent, patient-led organization, shaping the future of kidney care from the patient's perspective. As a fellow kidney patient and experienced care partner, I've seen firsthand both the challenges and the resilience that define our community. I know what it means to navigate the realities of kidney disease, and I also know how the hope that comes when patients, families, clinicians, and innovators come together with a shared purpose. For 5 decades, AAKP has been committed to empowering patients, supporting innovation, and driving policy to transcend the status quo, high mortality kidney care. This year's National Patient Meeting, 50 proud years of patient education, 50 years of saving lives, 50 years of saving livelihoods, is not only a celebration of our past, but also a look forward to the future we continue to build together, one of greater patient care choice, greater access to revolutionary innovations in kidney care, and far better outcomes for the 850 million individuals worldwide whose lives, livelihoods, and families are impacted by kidney disease. Over the next few days, you'll hear from leading experts and trailblazers who are driving change in research, innovation, and policy. But most importantly, you will also hear from our fellow patients, advocates who live with kidney disease every day and who inspire us with their courage, determination, and vision for what the future of kidney care should be. Transcending the status quo kidney care is a complex task. The challenges are great, but so are the opportunities before us. Together, through collaboration and a steadfast commitment to doing what's right for patients, we can and we will save more lives, livelihoods, and reduce avoidable suffering. Now I would like to take a moment to introduce a special guest who has looked forward to providing us with her own kind-hearted welcome to the great state of Texas, Representative Beth Van Duyne, co-chair of the Congressional Organ Transplant Caucus. Representative Van Duyne has collaborated extensively across the House and Senate on bipartisan efforts to expand transplant opportunities for all Americans in need, and we are honored by her participation with us today. Congresswoman?
Welcome to North Texas, everyone. And thank you to AAKP for inviting me to your 50th annual National Patient Meeting and for your relentless patient-led advocacy on behalf of the millions of Americans suffering with kidney disease and organ failure. I am very pleased to say that during my tenure in Congress that I have collaborated with a number of these issues. It has been inspiring and meaningful. Life-saving transplants are a courageous act of faith and love that represent the idealism of one human being saving the life of another. And as co-chair of the Congressional Organ Transplant Caucus, I am focused on practical and bipartisan reforms that save lives, livelihoods, and avoidable costs to American taxpayers. Based on the feedback from transplant experts, from organ donors and patients, I introduced the bipartisan Removing Burdens from Organ Donation Act. This is to cut red tape so donor hospitals and OPOs can communicate instantly and move faster when every minute counts. And many of you in this room and watching this program online helped push another common sense solution that I led, and that was the restoring life-saving organ transport to the passenger cabin of commercial aircrafts and out of cargo holds, just as they had been transported before the tragic events of September 11th, 2001. AAKP's advocacy was critical in these efforts, and we are now working with DOT and FAA to complete those above-wing best practices nationwide. Looking forward, we need better transplant medicine so that donor organs last longer and fewer patients return to the wait list or dialysis. We must also accelerate responsible xenotransplantation research and support artificial organ innovation to expand options for patients and address the current organ shortage. Our shared mission is to increase transplantation and life-saving organ donations. I encourage you to keep raising your voices in support of leaders who are working to solve the problem and to keep engaging with our staff. Patients and organ donors are the true experts on what needs to be done to save more lives. Without your insights, our work will never be successful. I also encourage you to continue to vote as kidney voters. I applaud AAKP for their national nonpartisan voter registration programs that has united the patient community to be even more effective in backing congressional reforms. I promise you, I'll keep working across the aisle with my colleagues and with partners like AAKP until every patient has an opportunity to live a longer, healthier life and to pursue their aspirations just like any other American. Thank you.
And thank you, Congresswoman Van Duyne. AAKP will continue to work alongside you and the Congressional Organ Transplant Caucus to secure research funding and accelerate the new innovations in transplant drugs, artificial organs, and xenotransplantation.